Hi, I'm Kayla Sanchez. Let me pull up my presentation real quick. All right, so I'm going to be talking about tuberculosis. It's a respiratory system microbial disease, and it's a very interesting disease because it's led to many things that have happened. One of which was New Mexico becoming an official state. It was the reason why, or one of the reasons why New Mexico officially became a state. I just thought that was an interesting fact. So let's look into it. Okay. Causative agent. The causative agent for tuberculosis is Mycobacterium tuberculosis. It's in the shape of a slender rod and it's an obligate aerobe. So it needs oxygen to be able to survive and reproduce. It grows very slowly and it has a 20-hour or more longer generation time. And they tend to grow in clumps. So you can kind of see in the picture that I have here, it's clumping up a little bit and they do that. On liquid media, it appears mold-like, which is where it got its name, Mycobacterium, where myco means fungus. And yeah. All right. Epidemiology. It's estimated that more than 10 million cases of tuberculosis develop each year. And of those 10 million cases, there are approximately 2 million annual deaths. And when we look at the epidemiology of TB, we have two different kind of types. We have latent and active. Latent is pretty much the dormant uh, form of tuberculosis, and 1/3 of the world's population has latent tuberculosis. In 2022 or 2020, my bad, 2/3 of new cases occurred in 8 countries. And the one with the highest number of cases was India, with 26% of the world's total cases of TB. Um, Tuberculosis also tends to go hand in hand with HIV, and it's the leading cause of death in those patients that have HIV. Right. I don't know why that button's not working. Okay. All right. Transmission. TB is spread from person to person via microscopic droplets in the air, and it can only be passed from an individual that has active tuberculosis. People who have latent tuberculosis cannot pass it. And some of its modes of transmission I've listed here on the slide. It includes coughing, sneezing, spitting, laughing, singing, and speaking. And although it's not a contagious disease, it is a contagious disease. It's not easy to catch. You would have to be around an infected individual for a long period of time. And those who don't have active TB, if they are treated oh my God, sorry. Those who do have it, if they're treated appropriately, after 2 weeks, or approximately 2 weeks, most of them are no longer contagious. So if you treat it correctly, then it should no longer be contagious after 2 weeks. All right, prevention. Like I mentioned, there's latent tuberculosis and active. The latent, uh, to prevent it, you can't really prevent yourself from contracting TB, but you can prevent it from spreading to others, like your friends and family. Latent, it's not contagious, like I mentioned, but you need to start and continue treatment because it can develop into active tuberculosis. And this is a big point. It needs to the medication needs to be taken consistently without ceasing, and you need to keep the same dosage because if you stop it, it could possibly lead to the bacteria becoming drug resistant, and that's not good. So, active tuberculosis, it is a contagious one, and it's can be prevented. You can prevent the spread by staying home, ventilating the room that you're staying in, covering your mouth, wearing a face mask. Those are the best ways of keeping it from spreading. Vaccination. There's also a vaccination for tuberculosis. It's not recommended though. It's only recommended to young children who are at high risk of getting tuberculosis and if they have a negative uh, skin test. Yeah, if they have negative results, they can take it. All right, signs and symptoms. Once again, latent tuberculosis, there are no symptoms. They're asymptomatic. They're infected but asymptomatic, and it can become active if untreated. Sorry. Active tuberculosis. Some of the signs and symptoms that are seen include coughing for more than 3 weeks, coughing up blood or mucus, unintentional weight loss, loss of appetite, fatigue, fever, my God, night sweats and or chills, and dyspnea. So those are the ones that are commonly seen. And symptoms, they don't normally occur until like weeks or months after primary infection. So it's kind of hard to tell like when it becomes active, because it's a long period of time that it can progress. I also included some risk factors of tuberculosis, and one of the main risk factors is a weakened immune system. Like I earlier mentioned, HIV, it goes hand in hand with tuberculosis because it weakens the immune system. So some of the other things that can weaken the immune system, there's AIDS, diabetes, severe kidney disease, chemotherapy, certain cancers, malnutrition, and drugs to prevent rejection of a transplanted organ. So if you get a new organ and you're taking medication for that, that could possibly weaken your immune system and make you more susceptible to getting TB. Another thing that could increase your chances of getting it is traveling or living in certain areas. So pretty much if you travel outside of the US to Africa, Asia, Eastern Europe, Russia, Latin America, you can increase your chances of getting it. Substance usage is another thing that can increase your chances of getting it. This includes IV drugs and excessive alcohol use. So if you're drinking too much, you're more susceptible. Tobacco usage is also another. And working in healthcare, you're around these patients who are sick, who possibly have active TB, and if you're around them for a long extended period of time, you're more likely to get it as well. Living and working in a residential care facility can also be included. I didn't put it there, but it's another one. And living with an individual who has active TB. Yeah, that will definitely increase your chances of contracting tuberculosis. All right. Pathogenesis. So the pathogenesis first, the patient will get infected with tuberculosis, and if it persists, if it continues, a walled-off lesion will form, and this is called a tubercle. And if the body defenses fail against the tubercle, it'll go into the alveoli of your lungs, and there it's ingested by macrophages. So in that first picture, it's there and it's already kind of consumed by the macrophage. And at this point in time, there are no symptoms. So this is the dormant stage of TB. And in the second step, the macrophages, it'll begin to multiply inside the macrophages. And during this time, the macrophages send an chemotactic response, and it'll attract more macrophages, and it'll begin to create a surrounding layer in the alveoli, and most of the macrophages are also unable to kill it, so they just release an enzyme, and that causes an inflammatory response. And this is bad in some cases because it can cause lung damage. All right, step 3. This is where disease symptoms appear. So you'll start like with the coughing, the fever, and stuff. Where's it? Sorry, I lost my place in my notes. The macrophages in this phase will begin to die. So they die and they'll release the tubercle, and it'll form what's called a caseous center. So like a little border around the tubercles. And because the tubercle is aerobic, it lays dormant because there's still no oxygen in there yet. And that doesn't come until step 4. In step 4, we have what's called liquefaction. So the caseous center will expand, it'll enlarge, and will form a border, and it'll create an air pocket where the tubercles can continue to multiply because now there's air in there. And this is called the tuberculous cavity. And in here, the released bacilli, the released tubercle bacilli will multiply, and there'll be more of them. And in the fifth step, this will continue until the mature tubercle will rupture, and it spreads throughout the lung and into the circulatory system and into the lymphatic system. Yeah. All right, virulence factors. So we have the outer membrane virulence factors and the inner membrane. The outer membrane consists of surface exposed lipids, which are basically complex lipids called PDIMs and PGLs. I'm not going to go into detail on that, but they're basically critical for a mycobacterium's virulence. And then we also have the PE or the PPE family. I'm also not going to go into detail on that, but just know that that's one of the virulence factors. In the inner membrane, we have what's called ESX secretion systems. They're basically protein secretions that play an important role in the bacteria's ability to adapt to changing environments. The more, again, I'm not going to go into it, but the more important ones are the ESX 1, 3, and 5 for full virulence. And here in the image, you can see on the bottom one, you can see the 1, 3, and 5. Those are the ones that are the most important. 2 and 4, they're still unknown, so there's not much information on that. Okay. Diagnosis. There's many different ways of diagnosing TB. You have the chest x-ray, and the x-ray is done once the individual starts showing respiratory symptoms or just unexpected illness. We also have the acid-fast staining culture, and the most popular one, or at least that I know of, is the tuberculin skin test. I've had this one done, and most healthcare workers have to get this done before entering the medical field. So basically, they put the little bubble on your skin, and then you go back a day or two later, and they measure it, and you'll get positive or negative results. There's also the IGRA, the interferon gamma release assay, and this is done as a screening or during contact investigation. And we also have the NAAT. That's another one. All right, treatment. So treatment requires a minimum of 6 months of therapy, and even short course treatment requires multiple drug therapy. So you have to take multiple drugs at the same time to attack it. We have the first line drugs. They're the primary ones used to counteract it. And the typical four, I'm sorry, I'm going to butcher these names, but isoniazid, rifampin, ethambutol, and pyrazinamide. Yes. And then the second line drugs, they're used if resistance develops to the first line. They're less effective. They may have toxic side effects, or they may be unavailable in some countries. And for those, we have fluoroquinolones, yes, streptomycin, which was the first successful antibiotic to be discovered that was effective against TB. And then we also have PAS, para-amino salicylic acid. Yeah. And then XDR, basically it's called extensively drug resistant. So at this point, the tuberculosis is almost completely resistant to any drugs used, and it's kind of a bad state, and it's virtually untreatable. So we're still looking to find a better treatment, more effective one that can be used for when it gets that far. All right. If you want to learn more about tuberculosis, these are two great reads. We have Phantom Plague, How Tuberculosis Shaped History by Vidya Krishnan, and Catching Breath, The Making and Unmaking of Tuberculosis by Catherine Lougheed. I already started reading Phantom Plague, and I think it's very interesting. It addresses basically the history, the social impact, it's a big one, from 19th century New York to modern times on tuberculosis. It's all about tuberculosis. And it also goes over how it adapted over time, over history. Is very interesting. I highly suggest it. And I also know that John Green, he's always posting stuff now and then on tuberculosis because he started a project for it. And it's very interesting stuff. I suggest you go look at it if you're interested. And yeah, here are my citations. These are the ones for the images, and then the one for my info and data. But yep, that's it. Thank you for watching and listening. And yep. Let me end this.